how is Mr. Gregory doing?
He is doing good. Would you like a quick report on him?
Yes.
Okay, so he is a 78-year-old widower whose only significant medical history was a permanent pacemaker that was placed 4 years ago.
Okay.
It was placed for sinus bradycardia of 38 to 42 beats per minute. The only reason that he had that placed was because he was a scuba diver and he wanted to continue to do that.
Okay.
He takes no prescribed medications. He only takes over-the-counter Tylenol for joint pain. So he came in because around 6 a.m. on Friday, he was having severe left arm pain. He drove himself here. By the time he got here, he was having crushing pain, and he was showing signs and symptoms of heart failure.
Okay.
So they admitted him to the cardiac unit, and they did a cardiac catheterization. So they did a quadruple bypass on him. And so after surgery was over, they admitted him here to the ICU.
Okay.
And he's been here since then, and he has not been able to regain consciousness. He's intubated right now, he's on the ventilator, and his stepdaughter is at the bedside.
Okay. Do you guys have any questions for us? No, right now, okay. Does he have an advance directive?
He has no advance directive in place.
Okay.
Do you have any other questions?
No, I don't.
Okay, the labs are in, they're in the chart,
Okay.
and then the doctors will be in later today to discuss the results that came in and the condition and what they plan to do.
Okay, thank you.
I'll leave this here for you.
Okay. And then what is your name?
My name is Marina.
How are you feeling?
Well, I think it's time.
Okay. I just have a couple questions for you guys. So what are you guys' values and beliefs, cultural and religious wise, if you don't mind me asking?
Well, my dad,
Mm-hmm.
my stepdad, he's had a very happy life,
Okay.
and my mom died 4 years ago,
Okay.
and I just think he wants to be with his mom, or with my mom,
Okay.
and I think it's just time to let him go.
And did he tell you that he wanted to be with his mother?
Yes, yes.
Did he have a will before he came here?
No.
No will? And then he has no advance directive
No,
either, okay?
that's what he would have wanted.
Okay. We'll talk to the doctors, and do you need me to call anybody for you? Do you want me to talk to you
There's
about
nobody to
anything?
call.
Nobody to call. Okay.
It's just me.
Okay. I'll be here if you want to talk as well, okay? All right. All right, I'll just done.
Hi, Nurse Bianca. Can you give me an update on Mr. Gregory?
Yes, he's been here for a couple days. He hasn't been able to regain consciousness. His heart failure is worsening. He has no advance directive and no will prior to coming. He has a pacemaker. And that's due because he wanted to be he's a scuba diver and wanted to continue. He has no medications prescribed, over-the-counter Tylenol. He was here for a quadruple bypass, and he hasn't been able to awake since.
Okay. All right. Thank you.
You're welcome.
Okay. Hi, my name is Dr. Granis. How are you doing?
I'm really sad.
Okay. All right. So your father, so his heart failure that he already has is beginning to worsen. And as a result of that, he's now gone into acute renal failure, which means his kidneys aren't working correctly. So what I would like to do is I would like to begin to start him on dialysis. I believe that is the best thing for him at this point.
Absolutely
and
not.
No?
No.
And he doesn't have an advance directive, is that correct?
Yes, but I'm here. I'm here for him.
And what is your relation to him?
He's my stepdad.
Okay. Well, Marina, I think it's really important that we do this dialysis because I believe he has a really good chance of recovering from this with the dialysis.
No, you don't understand. That's not what my stepdad would have wanted. He would have wanted to be in heaven with my mother. You don't understand. That's how he wanted things.
Okay.
You're not going to do that to him.
Okay. I understand what you're saying. Let me bring in the cardiologist and she can talk to you also, okay?
Hello, I am Dr. Quinton. I'm the cardiologist that took care of
Mr. Gregory yesterday,
What are you doing?
just listening to his heart.
Just let him go, please.
Nurse Bianca, do you have any updates, or Dr. Grannis?
I do not.
How has his urine output been
He
today?
has no urine output today.
Okay, because I noticed in his labs, like we had discussed, that it looks like his kidneys are starting to shut down related to the condition with his heart. So we really need to get some dialysis started so that we can get rid of those toxins and start helping him to get better.
No, that's not what he would have wanted. He doesn't want to be hooked up to a machine.
Right, absolutely. Well, without the dialysis, we can't take the ventilator off. So we really need to get it started as soon as possible.
You don't
so we can wean him
understand.
off the
He wants
off the
to
ventilator.
be with my mother up in heaven. Don't you understand that?
I understand where you're coming from, absolutely.
Then why don't you let him die in peace?
Does he have an advanced directive?
No, he doesn't. I'm the only person here. Why are you guys all against me?
I'm not against you at all, but if he has, what is your relationship to the patient?
He's my stepdad. He is almost my dad.
Do you have a power of attorney document?
No,
in
I
place?
don't. That doesn't matter here. He is my dad.
Well, as a physician, it's my responsibility to give my patients the best possible chance to live, and without dialysis, we're not giving my patient the best possible chance to live. He will have several good years left to spend with family and loved ones and doing things he enjoys.
That's not
But
what
it's
he would have
important
wanted.
to get
That's
this
not
done
what
soon.
he would have wanted.
Without anything in writing, I'm not sure what you want me to do. It seems like you're pretty upset right now. I understand that. I know this is a very difficult time for you and your family. I have some other patients I'm going to go check on, and I'll be back in a little bit to
No, just leave.
visit with you.
Just leave.
Bianca, will you please take good care of him? Thank you.
I know you're upset right now. Is it okay
Nobody
if I just stay with
understands
you?
me. Nobody understands it. This is my dad.
It must be a very hard time for you. What I'm gonna do is I'm going to talk to the case manager, see if she wants to come in here and talk to you. Is that okay? She's just gonna talk to you about what dialysis is. Do you know what dialysis is?
So,
No? Okay. So
but
what
my dad would have.
Okay. Well, she'll come in and talk to you about what it is. Do you have any other questions for me? Can I bring you some water, some ice
No,
water?
I just.
No?
No, just
Okay.
go away, please.
Okay, I'll be right back, okay? Hey, Kelsey. This is Marina, the patient I was telling you about earlier. She's refusing dialysis and just needs somebody to talk to her. Okay.
Absolutely.
Hi, Marina.
Hey.
Hi, my name is Kelsey Gabrielson. I'm with Case Management. You can call me Kelsey if you'd like. How are you feeling today?
I'm very sad. This is a very hard day for me and my dad and everything that's been going on. First it was my mother and now my dad. And I know my dad doesn't want to be here anymore. I know he just wants to be with my mother.
I hear you.
And nobody understands. Everybody is just trying to stick him on machines and everything, and they don't understand.
What we're trying to do is trying to save his life, because that's actually possible for him to survive and spend more time with you and other loved ones and things that he enjoys. So it's very important that we make the decisions to the best of our ability, and of course your input is very important to us, okay? It may not seem like we understand because we have a different opinion about what we should do here, but I do hear you and I do sympathize with your situation. If I have, I apologize. Are you familiar with what dialysis is?
No, they just keep talking about it, and I know my dad doesn't want that.
Okay. It could be really uncomfortable and scary to put him under care that you don't necessarily understand, but dialysis is actually a fairly simple process. Right now his kidneys aren't working properly, so that means, I know, it just means that he has toxins building up in his body and in his blood. But with dialysis, the machine does the work that the kidneys would normally do, and it gets those toxins out so that his body is in better shape and he can actually recover from this.
This is gonna help him.
Mm-hmm. There's a very good chance, according to the doctor, that he will survive if he gets dialysis.
I don't know. I don't think he could go through this. I know he just wants to be in heaven with my mom.
would you be interested in some resources? I could refer you to a support group for people who are going through something similar as you, with people who require intensive care, such as Armand here. And I'd also like to go over some more information about dialysis, because it's really not.
I just can't all this
It's a lot right
information.
now.
I just
It's a
want to
lot.
talk to the doctors.
Absolutely.
I don't want to talk to anybody else. You're changing my mind, and I don't want it. That's not what my dad wants. So just please, just get out.
Okay, I will give you some space.
Just get out right now.
Hey Marina, how are you doing?
Not good.
Not good. The doctors are here right now. Did you get some help from case management?
She was talking about dialysis and giving my dad a second chance to live, but I don't know. No, that's not what he wants.
Okay. All right. Well, I'm glad she gave you education. I brought some paperwork in here as well that you can look over. Not right now. I know right now is a tough time for you, but I set it on the counter. There's some papers that you can go over as well. Okay, about what dialysis is and how it can help and how it can help you and the support groups and everything. The doctors will be in here right now. Okay.
Hello, Marina. So I know that case management came in and talked with you. Have you made any decisions about your father?
I think you should we need to disconnect everything. I don't want the dialysis. I don't want nothing. I just want him to go with my mom and be in peace. And that's what I want, and you guys are not going to change my opinion.
Doctor, do you have any input?
I would strongly urge you to go ahead with the dialysis so that he can continue. He has an excellent chance of survival and doing really well after this. And the longer we delay, the worse it's going to get. We'd really like to get him off ventilation. The best way to do that is through dialysis. I have an issue taking a patient off of life support without any advance directive.
Well, you know, this is from listening to the family, this is what she really wants. I think that I would be okay with disconnecting him.